Hey guys, back with another video, and the topic for discussion for today is lung cancer. It's also known as lung carcinoma. It's a malignant tumor which is characterized by uncontrolled cell growth in tissues of the lungs. For simplification, I've divided this in three parts. First being classification, second is signs and symptoms and methods of diagnosis, and third is conservative and surgical treatment. Well, when we talk about classification, the first which should be coming in our mind is central lung cancer. Well, it's affecting the bronchi and its branches. First is main, second is intermediate, which is in between the junctions of the branches. Third is lobar, when it enters the lobar. Fourth is segmental, when it enters the segment. And finally subsegmental, just before the alveoli. When we talk about the nodular form, the first is endophytic growth, which is from inside the lumen to the outside. Second is exophytic growth, which is from outside of the lumen to the inside. And second is the infiltrative form, which is peribronchial, where we see a homogeneous pattern of growth of tumors around the bronchi. Second main that we have to discuss is peripheral lung cancer, where it affects from outside of the epithelial tissues of the lungs. From the bronchi, which localize in the lung parenchyma, that is from outer covering of the lungs. Well, based on localizations, it can be interlobular, subpleural. Well, when we talk about the apex of the lung, which affects the upper part, that has a specific name. It's called cancer pancosta. The third, that is atypical, that neither resembles to both, which is classified based on the metastasis. It can be mediastinal, that is affecting the mediastinum organs. Including the thymus, bronchi, portions of esophagus, trachea, and others. And second is bones, then brain, then gastrointestinal tract, then the cardiovascular system, and the liver. Now, we have to classify this in histological way, the first being the anatomical classification. The histological classification includes first is the squamous cell carcinoma, second the small cell lung cancer, which includes the oat cell form, and the cancer of the intermediate type. Next being the glandular carcinoma, including adenocarcinoma, papillary adenocarcinoma, bronchoalveolar cancer, then the large cell cancer, then comes the glandular squamous cell carcinoma. It's because it's dimorphic. Then comes cancer of the bronchial glands, that is adenocystic and mucoepidermoid cancer. Then, based on TNM classification, where T stands for tumor, N stands for nodes, that is lymph nodes, M is for metastasis, and when we say H, it's histological differentiation. It can be highly differentiated, moderately differentiated, lowly differentiated, or completely undifferentiated at all. Next part, the signs and the symptoms. When we talk about the nodes, which is local, because since it's primary, what we see is cough, hemoptysis, shortness of the breath, pain. The secondary nodes is due to the metastasis, which has inflammatory complications, and others include weakness, fatigue, weight loss, decrease in the ability to work. Bronchial obstructions or bronchial constrictions can be seen, which leads to hyperventilation, increase of the cervical and supraclavicular lymph nodes, emphysema, atelectasis, that is collapse of the lung, or degradation of the tissue, obstructive pneumonitis, which is associated with the occlusion of the bronchi mucus, and finally stenosis. Now, the method of diagnosis includes, first and foremost is the X-ray, then the general and biochemical blood analysis, urine analysis, bronchoscopy plus endoscopic examination of the bronchi and biopsy of the tissue, spirometry, abdominal ultrasonography, CT of the head, thorax and abdomen, and MRI with PET scan, that is positron emission tomography, thoracoscopy, that is endoscopic method of visual examination of the cavity of the thorax. And mediastinoscopy plus biopsy of the local lymph nodes. Now, treatment, it includes mainly surgical, or you can associate surgery with radiation therapy. Well, it has somatic dependence at age, associated decompensated diseases, and low function indication. When we talk about the oncological dependence, they are about the distant metastasis to the lymph nodes, mostly supraclavicular and cervical, then metastasis in organs and tissues like pleura, liver, kidney, etc. And distant metastasis to esophageal tract, trachea and diaphragm. and associated symptoms of superior vena cava, aorta, and phrenic nerve. Pleural carcinomatosis. The second way is the extended operation, that is, of course, lung resection with mediastinostomy, that is, mediastinal lymph nodes are removed. And third is combined operation, that is, removal of the infected associated organs along with it. Which includes like ribs, diaphragm, and pericardium. Thank you. Please like, share, and subscribe to my channel for more quality content. And if you have any doubts, please put it in the comment section. Thank you.